So we're live. I apologize for that technical problem. So please, everyone, we're gonna start over again by introducing our host for tonight. We're gonna start with Dr. Azza.
Yeah, hi. This is Azza. Is that a family nurse practitioner? I'm in healthcare field for 37 years. Started in the Middle East, Egypt. I worked in Saudi Arabia, and I'm immigrated to the United States since 1988. So I'm well versed with different culture, different backgrounds, and the aspect of the healthcare disparity and the healthcare, how people heal, recover, and live with their illnesses.
Right. Thank you
Nice.
very much, Dr. Azza. And our next expert is actually Dr. Lisa Blanchfield. Dr. Lisa.
Hi, good evening and morning to everyone around the world. I just wanted to be included so we could have a very important conversation about mental health issues during the COVID-19 pandemic. And I have been in practice for many, many years. I am
Say it, Lisa, say it.
I'm working mostly in Staten Island, but I also am now doing telemental because of COVID-19. And I feel that right now we need to have mental health communication. And more importantly, we have to focus on the crisis within our crisis, which is the mental health issues that have emerged.
Thank you very much, Dr. Lisa. And of course, what we are having our friends also for tonight as part of our guest panelists, and let me help them welcome. So we're going to start with our first panelist. Thank you so much, Dr. Lisa. So I'm going to put a spotlight on our first guest panelist. Please help me welcome. Her name is Melody Kelly, originally from Makati City, Philippines, now residing in New York City. She's the daughter of the founder of King Flute Philippines, the largest bamboo flute supplier in the Philippines. She is an accomplished flute player and flute teacher and has opened up for many Filipino artists in the New York area, including Miss Pops Fernandez, Coco Martin, and Vice Ganda, to name a few, recently along with other fellow Filipino Americans. She has participated in the singing of the American national anthem at NBA games in both New York City and Washington, D.C., as well as Christmas carols opening for the Rockettes at the world-famous Christmas show held annually at Radio City Music Hall. Please help me welcome Miss Melody Kelly.
Hello. Hi. Thank you for the nice introduction, Marlon. I'm 50 years old and I'm a mother of one. I have one son. He's now 21 years old and he's taking clinical psychologist. So I think it's the best time to talk about this. Anyway, I'm here in New York right now. I'm residing here, and about this subject of the mental illness. I have a bad experience because I lost my mother-in-law in COVID. So, but um, I'm trying to cope it, and I'm think. So, like,
Thank you so much, Melody Kelly. Our next guest is actually guest panelist. Okay, she's a graduate of Bachelor of Science in Psychology and former Psychology Society president of their batch at Dominican College. She has been active to social and civic outreach activities. She served as an elected council or councilwoman to the local government youth organization for 6 years. A resident of Jersey City, New Jersey, currently a member of Pan American Concerned Citizen Action League, PACO, and Ladies for Rizal, New Jersey. She's also an MC host in several festivals, community events, and private functions, a human resources associate, a mother, an awesome friend, and a good listener. Please welcome Amira Ala Arcangel.
Hi, good evening, everyone. It's good to be part of this very, I think it's going to be a very memorable event for MJ's one of the segments of Marlon. So I'm looking forward to, partake my experiences with amongst our doctors, Dr. Lisa and Dr. Azza and the rest of the panelists for tonight.
Thank you very much, Amira. Our next guest, I would like to introduce her to you. She's actually a good friend of mine, and she could be a good friend of yours too. All right. She's working in an insurance company in New York. Please help me welcome Elizabeth Cancino.
Hi everyone, good morning or good evening in every part of the country. I'm just a typical ordinary people you passing by in the street. I'm just a ordinary working person in New York who survives the 9/11 attack in New York City, and I'm here to share the good news of the Lord. Thank you.
Thank you very much, Elizabeth. Our next guest. All right, let me introduce her to you. I'm going to put her in the spotlight. She's actually one of my good friends. She's a writer, a mental health first aid instructor, a life coach. She's also a podcaster and public speaker. Please help me welcome Sharon Charles.
Hi, everybody. Thank you, Marla, for a great introduction. I'm here to learn from the doctors, to partake some of my what I've learned in teaching mental health first aid. And the time that we live in right now, I know everybody is in need of a little bit of mental health. When your mental health is in sync, I think everything is going to be all right. So sit back, get ready. We're here to teach and learn.
All right. Thank you very much, Sharon. We'll get back to you in a short while. And of course, our last but definitely not the least guest panelist for tonight. He's actually a New Jersey City University alumni, putting his education to good use. He's currently working as a care manager and community health worker for United Health Group. He loves being able to help those in need. He connected people to resources and local organizations. His knowledge and training is for all ages. He worked alongside nurses and behavioral advocates to provide quality care. He's currently working with Health First Steps members and those members who need specialists for their conditions. Additionally, he's also part of Life Next Chapter Foundation, where family health is number one. As a health educator, there's no better job for him to inform others on diseases and resources available to them. Lastly, he's a volunteer for church events and activities. Being a helpful part of the community is what he do. Please help me welcome Samuel Ramirez.
Hi everyone, my name is Samuel. Like Marlon said, I'm a community health worker. I'm pretty new to the health field. I've only been working about 3 years in it. But with Marlon, we've been doing some events. They've been doing stroke events, and basically I'm here just to basically participate and learn at the same time and be part of this great event that Marlon's put together. That's basically it.
Right. Thank you very much, Sam. And we're going to get back to you in a short while. So we are going to continue our discussion. Actually, you're still watching MJ's Make My Day. Please like, share, comment, and subscribe to us on our Facebook page. Follow us on Facebook, and also you can also connect us on our YouTube channel, MJ's Make My Day. I have a question for everybody. How do you manage your depression in the face of uncertainty? Are there further actions that you might consider taking to better manage symptoms in the COVID-19 pandemic? And to answer that questions, I would like to turn you over to our host experts for tonight, our licensed mental health counselor. We're going to start off. They are actually the Mona Lisa of Leonardo da Vinci, and we call them Azza. Lisa, I'm going to turn you first to Dr. Azza.
Yes, okay. So when we talk about the mental health, we have few aspects we need to talk about because mental health and stress and mental illnesses, everything is totally different. So right now, the stress that we are all experience, it's abroad and it's real and it's in every house. It's a manifestation. If we go through it and you check with yourself, you'll find yourself having one or two or both. Some of it, it's environmental effects. It's when you lounge just on somebody, you're getting mad on traffic. That's sometimes a cause of the stress. Sometimes it's physical, which is you're either aggressive or eating or to replace your emotion. So the stress goes on the physical, emotional, psychological, behavior, spiritual, and even environment. It's stress and it's normal, and that's what we can give some tips how to live with it. When it comes to mental health, this is you're still healthy because your mental is part of yourself, and it needs some health and some maintenance. And if we ignore it, or if we don't take care of it and address it, it can lead us to more problem and issues and become mental illness. So I think we're all mixing up sometimes the stress, mental health, and anxiety. And that's why, like, sometimes it causes some kind of a stigma. People want to shy away for variety of reason, and different culture more than others. But the time that we are living at is stress, and that's every single person. The good news is that we are still alive, and if we survive those 4 months or 5 months, that means we, one way or another, from what I heard, that everybody had exposed to some kind of stress. And I'm sorry for the one that lost their loved one, and the one that who suffered 9/11. And I've seen a lot of suffering also in the 4 months that I was working during the COVID crisis, the pandemic. So that means we either developed coping skills, or we already have coping skills. So this is the good news that I would like to share it with everybody. So that's my saying on the mental health and mental illness and the stress and the anxiety.
Do you have any question
But
for
Lisa
our
can
guest
take us. Sorry?
do we have any question from our guest panelists?
No. This is just to give some
Doctor-
kind of clarification, because we all sometimes, including the healthcare provider, we mix up what is what. So another word, we all have some kind of mental health issues and concern and stress. But if it doesn't disable us from our function, we are okay. We already developed coping mechanism. Sometimes just by sleeping, your brain will just reset and be able to function again. By talking to a friend, by doing some meditation, by exercising. This is all coping mechanism that we have it, and it's some internal mechanism to help us live with it. If it exceeds that level and you cannot sleep, you cannot function, you cannot wake up in the morning or go to work, you don't want to stay, you don't want to leave your bed, then it becomes an issue that will limit your living ability. And that's where you need to seek mental health specialists and to take it serious, because is it the body that affect the mind, or the mind is affecting? It's all connected, and nothing is, there is no one is more important than the other.
Dr. Azza, I have a question for you.
Sure.
Do you think the level of stress compared to 3-4 months ago, does it mean more stress than we are currently experiencing way back 4 months ago? Or what do you think is the big difference between the two?
I think the difference that it moved from the stress of fear to a stress of despair to stress of, it moved from the disease to some other aspect. So it became kind of broad, you know, it's like, it's hard to pinpoint where exactly the issue now. It went from having the storm that came in the middle of everything else, the conflict between George Floyd and what happened, and the economic. And so it's a combination of different kind of stress, but it's all coming out of fear. And if it continue, I think that's where, if people cannot really contain their emotion or divert their emotion to something constructive and helpful, that's where it becomes an issue to the community and to the society and to the whole world in general. And we see it everywhere, something that we cannot really be optimistic and say, close our eyes, it's not happening. It's really invasive, and it required everybody to be extremely vigilant and helping if by any way or shape to help others, to give a hand to somebody to lift up the person. And in return, like I was talking to Dr. Lisa, when we help others, we get the byproduct of happiness and satisfaction, and we feel that we are living meaningful life.
All right. Do you want to add anything to that, Dr. Lisa? I'm going to turn you over to Dr. Lisa. Thank you so much. The other part of the Mona Lisa or the Azza Lisa, Dr. Azza. Okay, I'm going to turn you over to Dr. Lisa Blanchfield.
Okay, good evening to everyone. I think I'm just going to focus on what is our crisis within the crisis. So we have the COVID-19 emergency crisis going on worldwide, but within that crisis, we now have a mental health crisis. So Marlon referred to the CDC report that came out actually today, and the research shows that 40% of Americans have an existing now mental health issue. So we have pre-existing, and then we have new symptoms, and now we have existing in 40%. That's a large percentage. We are all speaking to you from the New York City area, which was the hot spot, and frontline workers, first responders, nurses, doctors, EMTs, it goes on, police officers, all of the frontline people who have come forward are now going to experience post-traumatic stress because it's been a life or death situation, right? So they had 6,500 911 calls on a daily basis in March in the New York City metropolitan area. Of all of those calls, which is ridiculous, imagine you're trying to respond, there were many COVID-19 related illnesses. And all of our personnel who are very strong and they're resilient are probably feeling the trauma. We don't have a communication going right now for all of us, not just our caretakers, but for everyone in general. What are we doing about the mental health crisis? So I think that the communication has to be there. We have to talk about what strategies are helpful. What are people doing to get through the 3 M's, which are morbidity, which is death, mortality, which is we're all trying to stay alive. And then the last one is mitigation, which is all the strategies that have been imposed upon us, the lockdown, the health protocols, the masks, the staying at home, the isolation. You can't go to school, you can't go to a store. All of these environmental factors are now exacerbating mental health issues that many of us already had, but now we've added on all of these other factors, which has created, of course, we need crisis intervention for mental health issues is basically where we're at. And it's been 5 months, but the damage is already there. And we're going to see more damage and more issues. We have mental health hotlines, we have suicide hotlines, we have all of us, psychotherapists, psychologists, psychiatrists, nurse practitioners, everybody's working to try to help, but we need to have the awareness. And I think we have to have more of a discussion concerning what's going on for us emotionally, rather than it is a physical illness, but it's affecting us in an emotional and a psychological way.
Dr. Lisa, the other day when we were having some conversation about this, you said that it's mental by nature, but somehow it's actually affecting our physical body also. So my question is, when is the right time for a person who's actually having this type of experience? Because just like what Dr. Azza mentioned a while ago, it could be the level of stress could be more now that we are experiencing this COVID-19 pandemic compared to how it was. But what is the initial, how do you call it? How would I determine if I need to consult about my mental health?
So the medical illness that we all experience at some point in our life causes psychological trauma as well, right? Because once we get a diagnosis, there's fear, there's anxiety, there's depression. So we start with this COVID-19 emergency health crisis, but it turns into something emotional because our physical nature, the physiological part of our body starts to affect our mind. So we can have a physical illness or a disease or a disorder, but it's going to affect us psychologically, but we don't always address that. And Azza spoke about that, the mind, the body, the spirit. We have to combine all of it in a holistic approach, because sometimes psychosomatic symptoms come out and it might not even be physical, it's all psychological. So it's really hard to tease out which part of your symptoms are physical and which part are psychological.
Very good. Anybody from our guest panelists, do you have any question for Dr. Lisa?
Mm,
You want to say something, Elizabeth?
okay. You said that it should be a combination of body, mind, and spirit, right? So, and if we have all this kind of, say, therapy and solution or this medication, why is the statistics based on, even in pre-COVID times, there are more cases of suicide and all this kind of crazy things. Do you know what is missing in men that causes this kind of disease or stress in every being?
So there's organic brain disorders and psychological disorders, but as far as suicide is concerned, it's clinical depression. It's probably gone undiagnosed. So right now, the suicidal ideation, it has increased because we get to an extreme point. So in the beginning of any illness, what's the first thing we do? We call the doctor, make the appointment, and go to see a doctor. But with mental illness, we ignore it. Right. So we say, okay, I have all these symptoms, but where is this coming from? We don't know. So the problem is that we don't have the communication that's needed from the very start of any of the symptoms. We think about it, we talk about it, we tell everyone, we discuss it, but not with a professional. So you need a licensed professional that's able to diagnose and then treat in whatever manner they believe. It could be holistic, it doesn't have to be pharmacology. It doesn't have to be medication. It can be whatever the treatment plan is, but the problem is the identification. The stigma is always there, and people don't recognize the symptoms, and they don't know the severity of it until it's absolutely too late.
Can I also add something to that question? Because I believe that's very valid, important question. I think when I was doing my schooling for my doctorate, and I was trying to find out what is missing in relationship between practitioner and the client and the patient. And I find that the doctors themselves, they're extremely busy and overwhelmed, and they don't have the time to take to explain to the patient when they come to the clinic to what can they do for whatever illness they have, regardless to if it's mental, physical, or any other illness. And it's just like the quick fix of let's take care of the problem. You have diabetes, I'm going to give you on blood pressure treatment. And up till now, even we are in the crisis, like Lisa mentioned, and it's in the pandemic, you never hear about taking care of yourself, taking role, being active and taking care of yourself. It's not like, oh, let me find a doctor, let me find a nurse, let me find a psychologist, let me find a neurologist. What about me? I am the patient, right? I need to know how to eat, know how to walk, need to walk, if I can walk, or exercise, or meditation, hypnosis. There are so much resources now for people to take responsibility for their health. Not to say, I'm going to the doctor tomorrow, I'm not going to eat today because I'm going to lower my sugar so the doctor will be happy. So we are not pleasing the doctor. So I'm not doing the doctor a favor that I am perfect, showing him that I'm perfect, where I'm cracking down and I'm just adding to the issue from stress. Oh no, are you stressed? Are you sleeping good? Oh yeah, everything is perfect. You need to sleep. Our body is like a machine. Like you wouldn't run in the car without changing the oil and making sure that the heat is on and maintenance. Our body is not built for that kind of that the speed of technology that we are living now with and I'm afraid that we're going to find 15 years from now about the cell phone and the emails and all that stress, what's going to happen to us. So what I'm saying is we need to take responsibility and to let the patient take responsibility for their health as well. Because if I'm a patient and I'm coming to Lisa and I give her a wrong information, she's not going to be able to help me. So I need to educate myself and know my body and feel what is normal and what is wrong, because I'm the one who's going to give the information to the provider, and the provider, based on this information, going to decide what's going on. So if I'm not aware about what's going on with my body and that my body needs to sleep, my body needs to move, my body needs to rest, I'm not going to just have a medication that can help me. So it goes both ways. And I think the problem, what we learn from, I believe what we learned from this crisis, that we had, I wouldn't say like poor healthcare overall system. Considering also we are number 28, I think, on the world in terms of the healthcare. So we have a lot to learn, and I think it's going to be the new normal. Is going to be a new, fresh realization to what needs to be done. And I think every single person, including us, have to take responsibility for our health, for our future, for everything that we need to create in our life. That's my opinion.
Okay, just have one more question, because according to some, one more question.
So you can have two more questions.
This is
only for you, Elizabeth.
Because as I heard, most of the patient that was healed or was were able to overcome this kind of diseases is when they found love in their in their say in their environment. Say like the dog is also a kind of therapy, because you know the dogs can show some kind of emotions to human, and that eventually develop a hope or a reason, a purpose of one human being to go on and to move on and to come to a place that he was able to overcome all this kind of stress. Now, on the part of the health system, as you were saying, sometimes the relationship between the patient and the practitioner only becomes based on a professional level, that there is no more care. There is no because touch can also be a means of a healing power to the one that is concerned. I believe one of the reason that that's why I asked about the missing factor in this kind of COVID situation, the COVID-stricken days, is that love has become so what you call it becomes, men become lovers of oneself. One becomes doesn't care about his neighbor, doesn't, although we will find some, but most of the population now doesn't have, they seems to be so angered for something because they are afraid of something. But they said when love conquers all, so when there is love, I believe it will also develop some kind of it's not a kind of attachment, a healing process to the one that is involved in this kind of therapy. That's my, is it one also a factor that that practitioner can also use to their patient to show love? Because if it's just say you all hear all the problems, but you just give medicine, but there is no concern or care or love for the patient will just deteriorate, because they have no reason to be able to go on look forward or move forward
Mhm.
for for this
So-
kind of
So
solution.
when you ask about the depression and the suicidal ideation, the problem with mitigation and what we're trying to do to stop the virus is to
Mhm.
isolate people. Isn't that one of the key factors in the protocol? Okay, so
Mhm.
we're all being told to isolate. How does that feel when you're isolated from the people that love you or that you love? And if you have a pet, that's wonderful because you can be home in the house. But what COVID-19 has done is, I think we're even more separated. We're even more not in touch. You can call, you can do the Zoom sessions, but the human touch is not there. We can't touch anybody. Also, that's the other factor. You're not
That's
supposed
why
to touch.
that's why I'm trying to say
What?
that one of the factor that is missing right now because of the stress
Yes.
is the touch of human and the love that was being shown to one another. Now, if that
This is
person
not right. It's not being recognized though.
Mhm.
Right now, we're in the stage of trying to stop the virus. That's our crisis, right? But what's happening is we have stopped human connection, human interaction. Even the frontline workers and healthcare workers, they can't even sometimes go home to their family because they can't spread the virus. So they're working under such stressful conditions and they can't even have that human connection, loving connection with their own family. So it's devastating in many ways, but I think not being able to connect with someone is probably one of the most difficult parts.
that's why I want well, that's one of the factors I believe is one of the causes of this
I
stress.
agree.
And I believe this point, it should be lesson learned because from every crisis and the challenge and the crisis, we should come with a bigger solution. And I believe definitely that need to be a huge education and training on the relationship and empathic kind of caring, loving at all level of the healthcare professional to each other and to their patient as well. Because
Right.
we sometimes take it for granted that we are the healthcare provider and we're gonna tell you what to do, and we forget that you're a human being and you need to be cared and the process, and we need to understand your feeling and listen and to give you ideas and have you part of the plan, not as a punishment, but to give you the sense of control. Because as human being, we love to be in control and we like to make choices and not to feel like something is like I am your boss kind of, and you have to listen to what I'm going to tell you. It should be a personal kind of relationship. You are my client, I'm your servant, I'm here to serve you. I'm the doctor, but I'm here to serve you, kind of relationship. And I think this point is well said, and I really appreciate it. And I think that should be one of the lessons to be learned to the future.
Thank you, doctors.
You're welcome.
So anybody have any question, any concern? I mean, we can talk till tomorrow. It's very interesting and it's a very good point that was brought. Thank you so much for the opportunity, Marilyn.
So I have a question since I've lost um, one of my mother-in-law. So she was like really sick,
All
like
right. So, anybody from our panelists, do you have any question for Dr. Lisa or Dr.
Yeah,
Azza?
there was a question.
Melody has a question.
So, what do you suggest for the people that who lost their loved one during COVID?
Maybe
So
no one
so hard that it's so hard that we cannot even like say goodbye the last our last goodbye to her. Not even seeing her in the hospital and she died there alone. It's like I have this guilty feeling, that oh my God, I know it's not my fault, but then, oh my God, we didn't even see her. And then in my mind, I cannot picture how she suffered like that without seeing one of her loved ones and all that. So, what is because I'm sure I'm not the only one who lost their loved ones. So that's my question.
What was your mother-in-law personality, if you don't mind me asking?
Oh, she loves to be like with her with her loved ones, like us and the granddaughter and my husband and my father-in-law. She lives in Staten Island, by the way. So I've heard Dr. Lisa lives in Staten Island. So yeah, so there's like effect on that on my father-in-law also and my sister-in-law and also with me. So until now I still have this guilty feeling. Oh my God, I didn't see her. You know.
So she did get sick and she went to the hospital, or?
Oh, so she's been sick for like 2 years ago already. She's been sick for 2 years, and then she went um, nursing home, and then they said she needs to be in the hospital. It's because um, I think she got infected there. So she is in the hospital for 1 week, and then I said she got infected by COVID, and we cannot even like call her. Oh no, we called her, but we cannot see her because her phone. I think it's not as upgraded as now that we have a FaceTime or something like that. So yeah, so that's what happened, and then she passed away after like a week, and we didn't even see her. We didn't even say goodbye.
It's a very difficult situation, but sometimes you have to look at her point, like she's not suffering now. You know what I mean? Like sometimes we are selfish and we just want them to be around us and we want to enjoy them as long as possible. But sometimes we have just to let go and understand that was not her. That's not her life. That's not how she wanted to live. And she went peacefully and she's comfortable and she's at peace. It's going to be difficult, but right now what you're going through is just grief. It's a normal process. You know, the denial, the whole process of the grief that you're going to be going through, the anger, and eventually you're going to accept it and you're just going to have to live with the good memories. But there should be no guilt, really, because guilt is not going to help with anything. You cannot really improve anything in the past. You know, what happened is happened and happened for a reason. And she's in a better place. She's not suffering. She's at peace. You just have to live on a good memory with your family, with your husband, with your son, and always remember her life that she lived. And it doesn't matter what disease that she had passed on with.
I think what's so difficult is not having the closure. So we typically in our culture and in most cultures, we have a whole process we go through when we have a death. And in this type of virus and because of the pandemic, there are no stages of grieving which you go through, which you see the person and then they're passing away and then you start to make arrangements and then people come and support you and then the community is behind you and then the family's together. So what people are experiencing is there's no closure. It's the person was alive and then they passed away and we don't have the ritual that we typically have. So the grieving process is going to be a little bit abnormal. That is really helpful when you have the community assistance and support, right? People come, people talk, people are there with you to support you. But in the pandemic, people are losing their loved ones and they don't have a process to go through in order to somehow work through the most difficult time of everybody's life is a death. So I think that it's going to take you longer because you didn't follow the process and the steps that we normally go through. You weren't allowed to do that because of the virus.
Yes, thank you, Dr. Lisa and Dr.
Yeah, I'm so sorry for your loss.
Yeah, well, I'm trying to move on. Yeah, so it
It's
is
gonna
what
take time.
yes, it will. Right now, her ashes is still with us, so but we're going to have sooner, very soon. We're going to have like a mass. Well, hopefully, this is gonna be
Oh,
our,
great.
our closure for her because we're gonna have this a family gathering where we're going to have a mass for her.
Very nice.
Thank you.
That will help.
Thank you, girl.
Thank you
Yes.
so much. All right, so I have another question for our experts. So I would like to say thank you to Elizabeth, and also thank you so much for Melody. That I think that is you're very brave to be able to share your experience. And all right, I hope you get better, and eventually, I think this is a time that is not enough for to say. There's just like what we all know. Sometimes with a situation like that, it's very hard to really express ourselves. The emotion is like too much for us to handle. But my question for Dr. Lisa and Dr. Asa, we are practicing social distancing. Do you think what is the disadvantages? We know for a fact that there's a lot of advantages. Why do we have to do social distancing? But is there any disadvantages of doing this in terms of our mental health, Dr. Lisa and Dr. Azza?
So if you have a pre-existing condition with anxiety or depression, this will exacerbate it, and your symptoms will obviously get worse because we have to distract the brain. So if you have anxiety and then you're told, you can't go out of the house, what are you going to do in your home? So people are trying to exercise. I see people out, they're riding bikes with masks, they're walking with masks, they're running with masks. We have to be able to somehow socialize and then also go back to a routine that is helped with the anxiety or the depression. So with this exasperation with the virus and being told you shouldn't even be, you have to be more than 6 feet away from someone, the socialization isn't there, right? It's just not happening. So it's obvious that's why our numbers are going up, why 40% of Americans are they're admitting to having mental health issues because it's not helpful at all. It's going to actually heighten the symptoms.
Yes, and I have a follow-up question to you because I know you're also an expert when it comes to cultural background. Do you think the cultural background has something to do when a person decided to go and seek help, like an expert advice?
Well, I'll have Azza add to this, but there's definitely a stigma in many cultures. We're not completely there in the American culture. We still have the taboo and the discussions, and it's not real, and it's a myth, and it's a theory, and it's not. Mental health is not always addressed the same as physical health. But I think Azza could speak more about cultural taboos and the stigma that's attached. And there's just not, I would say, for mental health issues.
Dr. Asa?
Yeah, actually, I believe that the mental health is just like a stigma and nobody wants to hear it or deal with it. And as a clinician, we sometimes have to go and explain what will be the outcome or what will be the negative result of not addressing the issue. So they can understand it and they can deal with it in a better way. But at the same time, for us as a community and as a human being, we have to take this as a challenge. This is something we are writing history now. We are living in a time that this is something that didn't happen 100 years. So I always believe with every big challenge, there is a big opportunity, and we have to direct our mind and our focus on solution, how we can make our life better, what is the lesson to be learned here, how we can make ourselves, develop ourselves professionally and personally to be stronger and to be able to come out of this situation and the challenge, say, I'm a better person now. And the only way we have to just take care of ourselves. We have to self-care, and self-care is not something selfish. It's just like you have to know your limits, you have to respect yourself, and you have to protect yourself from not just the disease, but the stress and the toxic relation and the toxic environment. We don't have to listen to the news 24/7. There is nothing new, because whatever we're gonna process and keep in our mind, that's why the mental health is so crucial, not the mental illness now, the mental health, because our mind is the most powerful thing ever that is being right now trying to be discovered. And we realize that this is our asset. If we know how to think and the quality of our thinking will affect the quality of our life, and the quality of our life will be affected the community, the family, the society, and the world. So we have to develop the good quality of thinking and future planning, and to think positive, not to dwell in the past, and to come out stronger and happier and be resilient. We survived it. It's painful, but that's part of the growth. You cannot have a big
So
growth without
Mhm.
challenge.
what do
So
you
we're
think is the
in
stigma
challenge now.
though? What do you
It is
specifically
a
think is,
stigma, but let me tell you something too. I just listened about the coronavirus now, that people are trying to hide it. It's been a stigma as well. I was shocked when I learned that. Like some people now refuse to say that they have
Oh,
COVID-19
yeah.
in the Middle
uh,
East and here and everywhere. It's
And
like,
even in the
don't tell
Philippines
me.
too. So
And if there is a doctor got COVID-19 and they die, the family refuse to take the body or to bury it, which is a shame.
yes.
So to say the least, if mental health is, at least the mental health is something that they cannot control. I mean, neither one you can control, and nobody should be penalized for being sick.
Mhm.
so
You know,
how
this
are
is the point.
we getting the message out though? How can we talk to people and say it's okay to
We can
have a
talk to people.
psychological?
It's your mind is your health, and you take care of your mind. You shape your mind. You empower your mind. You
Right.
change your mindset, and you can change your life. This is a life-changing talk, and I've seen life was changed by just trying to give hope, by trying to be caring, by trying to give some respect. When I deal with the opioid crisis and I see a human being, they're ashamed of themselves, and some of us make them more ashamed too. So if you're talking about stigma, we are also give them that feeling as well. Sometimes, not all. So in order to take care of the issue, we have to be realistically talking that the conversation, the taboo, it has to be crucial conversation that we are afraid to say to somebody, you need to speak nice to your patient. It has to be said.
Right.
Nowadays, everybody have to be trained how to talk to the patient and remove any label. I'm not going to say you're mentally ill, you're homeless, you're old, you're from a different country. We have to remove that. We are a healthcare provider. We have responsibility to remove. Before we remove the stigma, we have to remove the label.
Mhm.
That's how I
The only
see it.
problem is without the
You know?
label, you can't get treated. So in mental health treatment, you have to have a label. Otherwise, there's such a lack of services. We are suffering from a lack of mental health services before this crisis. And in order to get help, you have to be identified as a person with a diagnosis. We can't
Sure.
just say, okay, I'm going to treat you, because we have high deductibles, we have high copays, we have people that don't even have insurance to cover mental health services. And we don't have a lot of free mental health in this country. I don't know if you guys can talk about what's going on in the rest of the world, but there's very few services that are not expensive, and many communities don't have the response that they need to the mental health crisis that they're experiencing.
I believe there will be a new social order. There will be more talk about preventive medicine, where hopefully avoid all this kind. I'm hoping that when people be treated nice, eating right, having the nice environment, there will be less mental health, there will be less disease, and there will be more entertainment, more living. We are not living just to go for doctor and doctor and doctor. We're supposed to be living to enjoy life. And mental health, it shouldn't be in a country that leading the world, you know what I mean? And there should be no homeless. There should be, in my opinion, there should be no homeless, no mental health illness, and no stigma. Or if I have issue, we should be able to say, I need help. But
at least to talk
just
about it.
saying that there is a stigma, we are admitting that we are not open to listen to people and to deal with them as a human being, I think.
That's true. And I think, Dr. Azza, this is one of the reasons also why we are deciding to have our coming shows with you, with Dr. Lisa and Dr. Azza, that we'll be calling it the Glass Half Full, which is going to be aired every third Friday of each month at the same time, 10 o'clock over MJ Make My Day. So I think that is something that our audience, not only in the United States, but also the people that are actually watching right now over in the Philippines or in Japan or in another part of the world, that they can actually follow us. And once we started the glass half full, I think they will be learning a lot from this discussion also. Because right
And
now,
there is a hope. There is a hope and there is possibility, and
there is, and I would really
can
like to
make a
say,
difference.
yeah, I would really like to say this just in the beginning of your speech also. You're actually giving us a hope already that after we combat, after we gone through with the COVID-19 pandemic, the stress that we have, we are going to be more stronger as a person, and we'll be more prepared,
Absolutely.
you know?
Yes, and we're gonna give a hand to somebody else, and we're gonna remember what we went through. That I'm sure Elizabeth, she went through the 9/11, and I can feel that she's very spiritual and she's very a human kind of loved person, and that's what we get when we come out of any struggle or any challenge. And we're gonna have to give hands to more people to be able to rise up to a better living.
Thank you so much. Okay, so as you can see, we're actually giving some overtime. We'll be extending for another 10 minutes. Thank you so much for those who are watching us over in the United States and also watching us in other part of the world, whether you're in the Philippines or you're in Japan. We are opening now the 10 minutes question and answer. So we'd like to give the floor to our panel guest panelists, and feel free to ask questions to our experts, Dr. Azza and Dr. Lisa Blanchfield. We're going to start with you, Amira.
Okay, so during these trying times, the COVID, we're now in the COVID era. So every individual in the United States and around the world globally, we are suffering financially, emotionally, mentally, physically, and spiritually. So and aside from that, there's a division that there is a division in our society nowadays. And what can we do to address this issue? For example, us who are non providers, how can we help our common friends, relatives, family members who are having this kind of issues? Are there other, and my second question, are there other group of providers who are giving group therapy for free so that they can have an access to a free session, at least just to help them ease their depression and anxiety that we are experiencing right now in the United States and globally? Because I myself, I am catering to all of my friends from different countries, different times. So I wake up on a different hour, and they're asking for simple things that they're vent out on me, like financially, about jobs, about divorce, them having COVID. And I myself, one of our staff that I was just assisting in our office as a human resources, who passed away. And it's hard for me. I cried for a week because I'm the one assisting him with all he's a physical therapist and I work in a healthcare industry. So it's hard for me. I was crying for a week. And every time I see the name of the therapist, it's like, in just 2 weeks, that's it, he's gone. I never get the chance to speak with the person, as what Melody was telling us her experience. It's hard. So what are the basic things that we can do to help our common friends who are non-providers? What can we do, or what are the free services, group therapy that's it's out there in the society?
Well, I can tell you right now, everything is telehealth, telemental health, things, groups online. If you, especially on YouTube, you can go to learn mindfulness strategies, which is very easy. You don't have to be a clinician. You don't have to be trained in it. It's meditation, hypnosis, deep breathing, imaging. There's so many different ways for you to have some calm during all of this, during the crisis that's going on. And all of that is free because it's all on YouTube. So any kind of self-care, any kind of soothing exercises, you can do that yourselves without, and you can actually get help with it. Everything is right now being done by remote, right? We can't get together. And even I work with a lot of people that have addictions, and they're doing their sessions online with the people that are having the same experiences they're having, and the support is there. I would just say you'd have to search to see what type of group you're looking for, and people are really reaching out to each other and supporting each other virtually. That's right now, that's probably the only way we can find some sort of relief, you know, and strategies to help us feel better.
I have another strategy as well, and I don't know. I hope you guys don't take it like an offensive, but when people complain that they are feeling depressed, that they are isolated sometimes, I was working during the coronavirus, and through March, April, and first 2 weeks of May, I was seeing 8, 9, 10 people dying every single day. And it was scary. I felt like the end of the world. I'm in a movie. I go home every day and I say, oh my God. I was asked to cover 2 places because medical director, assistant medical director, 2 physicians, director of nursing, name it, they were out sick with the corona. And I felt like God give me some health and I need to be there. And everybody said it's a mistake. I get personal call from every single friend, stay home, don't go. And I did go every single day, scared, but I survived it. I'm coming out appreciative of life. So you can look now and you say, I'm poor. And I remember I used to tell some of the staff, don't worry about money because people want to do 2, 3 shifts because now there is potential to make extra money. I said, now we need to do just to live, to survive, to help people because that's our calling, and to survive, not to make money now. So there is a stages of life that you come out, you say, I'm glad I'm alive. I'm going to be poor, I'm going to be broke, that I can always make that up. So when you have that attitude of gratitude and looking at what you have and the positive that you are still alive after you looking at number, what is the number of death so far?
The number of confirmed deaths for all over the world is 745,000.
Oh my God, we're going to almost 1 million?
Yes.
Okay, so you are one of the lucky one. That's a higher rate than the lottery, winning the lottery, that you are alive. So when you think every single morning and you open your eyes, you said, I'm healthy and alive. I used to come home, go to the shower and isolate myself from my family and even my teeth. I'm so afraid of everything. But you have to replace the fear with action, doing something. So what I did is taking care of myself, taking all the precaution, the isolation, all the technique that we were advised, because nobody up till now knows exactly what's going on. But usually action cure fears. So you take action, you take care of, you do something positive. You think of go and make some fruits like my daughter always make those green fruits and the healthy shakes, and you create something new, you know, and you feel good about yourself. And slowly when things are done, you will be a bigger person that have a bigger dream, bigger potential, and you can make up for all the loss. But for right now, and my second advice, if you feel somebody is drowning you down and need advice, and instead you're giving advice, but they are pulling you down, back off, because you're not going to help the world. You have to help yourself first. There are some people who will pull you down just by seeing why you're still positive. What's going on? Something wrong with you. Stay out.
Stay out of
there are 700,000 died, and there are millions are alive. So you have to
True. Yes.
Okay. All right. So thank you very much, Akira.
Azza and Doc Lisa, thank you so much.
Okay. All right. So we're gonna go to our. Thank you so much, Dr. Azza. Well, so we're gonna go on with our I think we have like 10 more minutes to go before we end our show. So, Sama, would you like to ask a question for Dr. Asa or Dr. Lisa?
Well, in my line of work, I have well, I work with people that come in and out of the hospitals, and basically they give us since I'm a community health worker, I have to reach out to them, see what they need after their discharge. So basically, for COVID, they make me give them a small like education of wearing gloves, social distancing, wearing masks. But for the most part, most people are like feeling a little better now. Like in, let's say, April, it was a little rough with members. Like you would talk to them, you would feel you could hear it over the phone how they were a little more sad. Usually, even my more upbeat members were a little more down. But now that as time's been going, and more people are getting tested, people are getting antibodies, everybody's feeling just a little better now. But for the most part, basically, what would be your best coping methods for basically coming back to reality? Because now, even though schools are starting, parents are starting to freak out a little bit. And basically, what's the best way to approach that? Like how to allow people to cope with it?
So these are the patients that you're working with at home? They're in the home?
Well, they get discharged from the hospital. They go home, and in case they need anything, I reach out to them. So, but basically, how to, because I also for my church, I also do the advocate for that for health, in case they need anything. And for them, it's always questions of like, what can I do to get my child like interested in doing school through online? Because basically keeping students at home has been making them feel different, because kids are supposed to be outside doing sports and stuff. So basically, what's the best way for parents to prepare their kids basically to return to the norm?
Great question.
So for now, we really, are in a state of flux and things are changing. And I think the best message you can give to anyone is just to live for today. We can only get one day at a time. So when we go towards the future, think towards the future next week, the week after, what's going to happen in 6 months, it causes an increase in anxiety. So I would just try to focus on exactly what you're doing at the moment and at that time. That's what mindfulness is all about. We have to live in the moment, because when we start to imagine and we start to go forward in our thinking, it gets to be catastrophized. We start to think, oh, this is what's going to happen. And the projections are not good. And when you listen to a lot of the health organizations talk about what could happen, what will happen, we need to just focus on today. And if you could give them that message, again, the mindfulness techniques to me are the easiest to learn and the healthiest, because it's all about living with yourself at the moment and not trying to think past what am I going to get done today. And with the children too, they have to just focus on the moment, really. We don't know what's going to happen. No one really knows, and we can't predict. And so that's the fear and the anxiety and the insecurity and what's going to happen. No one knows, right? So
Better
it's
just
best
encourage
to
be in the present, basically.
bring them back to the moment. That's the best advice I could probably, I give it to myself. I have to just get through today and not think about what's going to happen tomorrow.
And don't forget also, you need to embrace, and you have to let them also wash their hand frequently. They need to understand the cross infection. They need to understand to stay away from anybody, hugs and kisses and all that stuff for now. And also the nutrition is so important. We have to focus on eating healthy and being hydrated and sleeping well. They have to sleep. They have to take at least 8 hours of sleep. They have to eat well, healthy meals, and they have also to have some fun time with the parents, like Elizabeth said, where I don't know, see Elizabeth, about the love and compassion and empathy. there is a great benefit from just being loved and just to teach them to take care of themselves, because they are affecting not just themselves and when they come home or the surrounding, and they need to understand what's going on.
Thank you very much. All right, Samuel, thank you so much for the question. So we have another 10 more minutes to go. So I'm going to fast track everything. So I would like to call on Sharon. Thank you so much, Samuel. All right, I'm going to call Sharon. Sharon, do you have any question for our experts?
I have one question. Like I said, I like helping people. How do you go about doing what you're doing? And what you're doing, sometimes you feel like it's not enough. What do you do? Because to me, the more I do in helping people, the more I feel like I'm not doing enough. I could do more. And I battle with that a lot.
Azza, do you want to?
Yeah, so you know what you need to do? You need to copy yourself. You need to get more people on your team and to teach them what you are doing and duplicate yourself. So you don't feel guilty. That's just, I only helped one person. I see there's 10 need help. So get 2, 3 people, 4, 5, create your own team that they share your value and your ethics and your feeling, and teach them and give them meaningful. This is, I'm sure you feel great when you help people, right?
I do right here.
It's a wonderful feeling.
It's a wonderful feeling.
And that's why, you know, some people risk their life because you are touching people's life. You know, you're becoming like in a flow with them. So yeah. the only advice I would give you, just duplicate yourself. Okay. You know, create a team, 5, 6, 7. So now instead of you were touching 10, multiply the 7 by 10, and then you're gonna continue to grow. We can combat the virus. We can fight the virus with people like you.
Yeah, thank you.
Great. Awesome, wonderful. I wish we could buy something like a photocopying machine, right? So that we can duplicate Sharon and
we
spread
can.
it out to everyone.
Yeah. We can, you know, I think what you are doing now, if you helped one person to get a message and have that kind of compassion, you did a good job.
Absolutely. All right. Thank you so much, Sharon. All right. And Dr. Azza. All right. Let's turn you over to Melody. Melody, do you have any question for our expert before we continue with Elizabeth in a short while?
I think that was my question. So about how do you I don't have questions anymore. The hardest thing for me to do is to overcome is the passing of my mother-in-law. But I think I'm starting to feel a little better because of what Dr. Lisa said that about closure. I think I'm okay with that. After that, and I don't have questions so far.
Thank you, Melody. We wish you well. All right. So, Elizabeth, any question for Dr. Lisa or Dr. Azza?
At this moment, nothing yet.
Okay. All right. So with that, I would like to ask everybody some parting words. We have like 5 more minutes to go. I'd just like to hear someone from all our panelists and of course from our expert, any positive thoughts that we can share to our viewers all over the world. So we'll start with you, we'll start with you, Amira.
Oh, it's me. Okay, so
and everybody's my favorite too, so.
Well, all I can share is during any time of calamity, uncertainty, or any family problems, personal problems, and whatever is going on in this world, all I can say is that let's try to stay positive. And they say that smiling is contagious. So every time we smile to another person, it's a best smile. Yeah, thank you.
Awesome more.
So let's keep smiling and share our love and be passionate to other people, because we don't know what's inside of them, even if they're outside their house. um, they're showing a different personality, but deep down inside them, they have pain. So let's try to be nice and let's keep smiling. That's it.
And spread smiles, right? All right. So who's gonna be the next one? Let me see. How about where is Elizabeth? All right, is she still with us? All right, Elizabeth. Any
Okay.
positive words? Any positive thoughts for our viewers?
Okay. At this time of uncertainty, when tomorrow is not guaranteed, the only thing we could look up is there is a hope, as Dr. Azza said. In a lifetime, we are destined to die once, but there is one who could be able to help us to go to this life. There is hope in Christ Jesus, because he said he is the way, the truth, and the life. No one, there is life in him. The only reason that I could tell this, because as a survivor of 9/11, I have gone all this trauma, all this kind of stress. But one thing I know, that Psalms 23 keeps me alive, because I live by his words. His words are life. That's why I'm still here. And the love that he has shown me, I have shown also to each one of you, to share it to you that in him there is life. In him there is hope. In Jeremiah 29:11, it says that our Lord God said, I have plans for you, not to harm you, but to give you a hope and a future. So the Lord didn't give us, put us in this earth to be hurt, or to struggle, or to have a hard life. But it is up to us. If what we believe in is the one that makes you live, you live by it. But if you live by if you believe in what you know, because he's the one who will see you through all these COVID-stricken days, you will be able to live, because he is always there. He's the Alpha and the Omega. And everyone had the same feeling of fear, but fear will not leave us to safety. Only the faith that builds you up, and hang on to the one who is the author and perfecter of your faith. Thank you.
Thank you so much, Elizabeth. Very well said. Let me turn you over to Sharon.
Important, I can say, with everything that's going on, your mental health is your wealth. Recovery is possible. Don't be afraid to speak up. You're not alone. When you start talking to people, you realize that you're not alone. Speak to somebody. Tell them how you're feeling. Don't be afraid.
And I'm Sharon, because just like in the introduction, I told everybody, our viewers, there's actually a mental health first aider instructor. So would you like to invite them to join you next time for the next seminar?
Oh, sure. When is my next seminar?
Where they can reach you to, if they would like to have some more questions regarding the mental health first aid. Is there an email that we can actually say, or if not, we're just going to post it on our Facebook page?
Definitely. You can reach me at Maggie, MAGGIE.S.Charles@gmail.com.
Yes, so if you have questions related to mental health first aid seminar coming soon, please don't forget to email Sharon, and she'll be happy to address your question. Okay, thank you so much, Sharon, and I'll see you again. And Melody, are you ready, Melody, for your parting words? Any positive thoughts for everybody?
So my positive thought, I've been through a lot. I'm also a cancer survivor. So what I would say, pandemic, or if you're ill or that, don't lose hope, because God never sleeps. So, and also during COVID, my experience also, I've been having this anxiety and loneliness and all that. But you know what? I said to myself, life is too short. I kept myself busy. Like do I did, you know, my favorite things to do, and then I said, oh, yeah. spoke with I spoke with my favorite people, you know, and then my last words is
That's the reason why you talked to me the other day.
yeah. So sometimes I go live, you know, like I play
Yes.
my flute because that's my passion. You know, I want to entertain people. I want them to make happy. I want, you know, and then also don't forget to hug your loved ones. I know, um, like the ones that you're with, you know. Now we only do like virtual hugs, but since we don't cannot hug them like physically, then at least send them love. Send them love because it's a big it's very important to send them love. That's all.
Thank you so much. And of course, Sam, big round of applause for Melody. All right, Samuel.
Well, basically, just like for me, I'm a very positive person all the time, so it's been a little easier for me. But basically, just try to be as positive as possible. Keep your family positive as well, because eventually this will pass. You know, vaccines are being created now, and they're just basically waiting to be distributed for the most part. So basically, just stay positive, keep social distancing, and wearing your mask. You know, basically, that way we can get back to normal a lot quicker if we follow the rules for just a little bit. You know, and keep everybody safe, basically.
Yeah, wonderful. All right. And of course, the Mona Lisa of MJ's Make My Day. I'm gonna bring in first Dr. Asa.
What I'm gonna say is
All right, Dr. Asa.
She's mute.
All right, Dr. Asa.
You're
Hello?
in mute.
Oh,
Very good. All right, sorry, Dr. Asa.
yeah, hi. Yeah, so what
Right.
I'm gonna say is recognize your potential physically, mentally, and spiritually. You are as strong as your thoughts. Keep the positive thoughts.
Bravo. And of course, Dr. Lisa.
Well, Marlon, I just want to say that you inspire me. You have that huge smile, positiveness, your music, everything that you do lately. I really appreciate it, and I appreciate everyone who's here because I actually in my own pandemic world, connecting to people is what helps me. So I think being with all of you and reaching out, and everyone does these Zoom sessions. I do the Zoom sessions with patients, but I think this was relaxing because we were able to express ourselves and work together. And I just want to thank you, Marlon, for setting it up because without you, we wouldn't even
Yes.
have this discussion.
Yay.
So
I'm echoing.
1 year in the making. All right.
you made our day.
Yes.
MJ
Yes.
make our day.
Yes.
Yeah, that's why MJ make our day, you know. And please
Yes,
don't
yes,
forget
thank
to
you.
invite
Thank you.
everybody every third Friday of the month. They have a date with Azza Lisa. Okay.
Ah,
Yes.
all right.
Brilliant.
It's gonna be
Thank
the
you.
third Friday of the month. So to our guest panelists, you're always invited. You are making history because you're actually in the pre-launching of the Glass Half Full, which is
Yeah.
going to be a standalone show featuring Dr. Azza and Dr. Lisa. So please watch for that. It's gonna be every Friday at 10 in the evening. Okay. All right, Dr. Lisa.
Thank you so much.
All right. So
Nice
before
to
we
meet everybody. Thank you for letting us know each other. Thank you.
We're not over yet. We're not over yet. I still have to do
Ah.
my ending spiel. But before I end my spiel, I would like to say happy birthday to my brother-in-law Rizal, who's celebrating his birthday. And also, again, I did mention the Glass Half Full, which is every third Friday of the month. So you're going to have a date with the Mona Lisa of MJ's Make My Day. On behalf of Dr. Lisa Blanchfield and Dr. Azza Azad and our guest panelists, I would like to thank you for watching our show tonight. For any comment, questions, or suggestions, please feel free to email us at mjmakemyday@gmail.com. private message us at MJ Make My Day on Facebook, or leave a message at MJ Make My Day YouTube channel. Again, my name is MJ, and I am looking forward to seeing you again next time for another episode of MJ Make My Day. Good night, everybody.
Yes.
Bye.
Thank you so much. See you next time. Bye-bye.
Thank you.